Imagine doing everything right, eating your greens, hitting the gym, and avoiding salt. Yet your doctor tells you that your blood pressure is in the danger zone. It is a terrifying reality for millions who consider themselves healthy, but are actually walking around with a ticking time bomb in their arteries. Most people think high blood pressure is only for the sedentary or the overweight, but today we are stripping away the myths to reveal the hidden biological reasons why fit individuals are often at the highest risk. I am Dr. Queen from Senior Healthcare, and in this deep dive, we are explaining the silent truth behind why your numbers are high, even when you think you are doing everything perfectly. Today, we are tackling one of the most frustrating diagnoses a health-conscious person can receive, which is high blood pressure despite a clean lifestyle. You might be a marathon runner, a dedicated yogi, or someone who has not touched a processed carbohydrate in years. Yet when that cuff tightens on your arm, the numbers tell a story of hypertension. To understand why this happens, we have to look past the surface of diet and exercise and into the complex world of vascular biology and genetics. The first truth we must accept is that blood pressure is not just a reflection of what you ate for breakfast. It is a measurement of the force your blood exerts against the walls of your arteries, and that force is controlled by a delicate balance of hormones, your nervous system, and your kidney function. One of the primary reasons healthy individuals see high numbers is genetic predisposition, which is often beyond the reach of a treadmill or a salad. You may have inherited arteries that are naturally less elastic, or a renin-angiotensin system that is hyperactive, meaning your kidneys are constantly signaling your blood vessels to constrict even when there is no external stress. This is known as essential hypertension, and it can affect the most athletic people because their biological blueprint is programmed to maintain a higher pressure. Another hidden factor is the role of the sympathetic nervous system, which is your body's fight-or-flight response. In our modern high-stress world, many high achievers and healthy individuals are in a state of chronic sympathetic overdrive. Even if you feel calm, your body may be producing microbursts of cortisol and adrenaline that keep your blood vessels in a state of perpetual tension. This constant constriction causes the heart to pump harder against resistance, leading to high readings that don't seem to match your outward appearance. We also have to discuss the phenomenon of masked hypertension, where your blood pressure remains normal during your active day, but spikes during periods of rest or sleep, often due to underlying issues like silent sleep apnea. Many fit individuals with thick necks or specific jaw structures suffer from brief interruptions in breathing during the night, which starves the heart of oxygen and forces a massive spike in blood pressure to keep the system running. By the time you wake up and head to the gym, your body has already spent 8 hours under extreme vascular stress. Furthermore, we must look at the stiffness of the aorta as we age. Even in the healthiest seniors, the collagen and elastin fibers in the major arteries begin to shift and the vessels become less compliant. This is called arterial stiffness, and it is a natural part of the aging process that can lead to isolated systolic hypertension, where the top number is high while the bottom number remains normal. At Dr. Queen Senior Healthcare, we emphasize that being healthy is not a shield against the passage of time or the complexities of your DNA. Understanding that high blood pressure can be a structural or electrical issue rather than just a lifestyle failing is the first step toward proper management. We also see many patients who suffer from the white coat effect, where the anxiety of being in a medical environment causes a temporary but significant spike. However, if your home readings are also high despite your fitness level, it is time to look at the microscopic level of your health. Your body is a highly tuned machine, but even the best machines can have internal pressure regulations that go awry without any outward signs of damage. Moving forward into the physiological complexities that govern your cardiovascular system, we must turn our attention to the kidneys, which act as the master regulators of your blood pressure, regardless of how many miles you run or how lean your body mass might be. The kidneys control the volume of blood in your system by managing the balance of water and salt, and they do this through a complex hormonal pathway called the renin-angiotensin-aldosterone system. In many individuals who appear perfectly healthy, this system can become overactive due to microscopic structural changes in the renal arteries or simply due to a genetic glitch that causes the kidneys to retain more sodium than they should. When your kidneys hold on to even a tiny bit of extra sodium, it forces your body to retain water to dilute that salt, which increases the total volume of blood circulating through your veins. More blood in the same sized vessels naturally leads to higher pressure, and this is why some people find that even a low-sodium diet doesn't seem to move the needle on their blood pressure readings because their internal thermostat for salt is set too high. Furthermore, at Dr. Queen Senior Healthcare, we frequently investigate the critical ratio between sodium and potassium, which is often more important than the total amount of salt you consume. Many modern healthy diets are high in lean proteins and grains, but may still be surprisingly low in potassium-rich foods like leafy greens, beans, and certain fruits. Potassium is the natural antagonist to sodium, as it helps to relax the walls of the blood vessels and encourages the kidneys to excrete excess salt. If you have a potassium deficiency, your blood vessels remain in a state of constriction, making it much harder for your heart to pump blood throughout your body. We also have to consider the impact of chronic low-grade inflammation, which can exist even in people who look fit on the outside. This systemic inflammation can be triggered by undiagnosed food sensitivities, high levels of oxidative stress, or even an imbalanced gut microbiome. When your body is in a state of inflammation, the endothelial lining of your blood vessels, the thin layer of cells that lines the interior of your arteries, becomes dysfunctional. Instead of producing nitric oxide, which is a powerful gas that tells your arteries to dilate, the inflamed endothelium produces vasoconstrictors that cause the arteries to tighten up. This endothelial dysfunction is a silent precursor to hypertension and can be present in athletes who overtrain or individuals who consume high amounts of hidden sugars and health supplements. Speaking of supplements, many health-conscious people unknowingly spike their own blood pressure by using performance enhancers, pre-workout formulas, or even high doses of certain herbal remedies like licorice root or ephedra-based products. These substances can stimulate the adrenal glands to produce more cortisol and norepinephrine, which are the very hormones that tell your heart to beat faster and your vessels to narrow. Another hidden culprit for the healthy individual is the overuse of nonsteroidal anti-inflammatory drugs like ibuprofen, which are often taken to manage muscle soreness or joint pain from exercise. These medications interfere with the production of prostaglandins in the kidneys, leading to sodium retention and a subsequent rise in blood pressure that can last for days after a single dose. We must also look at the role of the hormone aldosterone, which is produced by the adrenal glands. Some people suffer from a condition called primary aldosteronism, where the glands produce just a little too much of this hormone, causing the body to lose potassium and gain sodium. This is a very common but frequently undiagnosed cause of resistant hypertension in people who otherwise seem to have no risk factors. It is essential to realize that your blood pressure is a dynamic measurement that reacts to every chemical shift in your body. Even the way you breathe can influence these numbers, as shallow chest breathing, often associated with high-pressure jobs or intense focus, can keep your body in a state of mild respiratory alkalosis, which further tightens the vasculature. At Dr. Queen Senior Healthcare, we believe in looking at these microscopic chemical drivers because they explain why the standard advice of eat less salt and move more isn't a universal cure. Your internal chemistry is a unique landscape, and sometimes the standard map doesn't lead to the right destination, which is why we must look at the kidneys, the adrenals, and the vascular lining to find the true source of your high readings. As we move into the final segment of our deep dive into the hidden causes of hypertension in healthy individuals, we must address one of the most significant yet frequently overlooked factors, which is the quality of your sleep and the structural health of your airway. At Dr. Queen Senior Healthcare, we often consult with patients who have low body fat and excellent cardiovascular fitness, but suffer from a condition known as obstructive sleep apnea. You do not have to be overweight to experience this, as it can be caused by the simple anatomy of your throat or the position of your jaw during rest. When your breathing is interrupted at night, your oxygen levels drop, and your brain triggers a massive release of stress hormones like cortisol and adrenaline to wake you up and restart your breathing. These nightly spikes in hormones cause your blood pressure to surge while you are sleeping, and eventually those spikes begin to bleed into your daytime hours, causing a permanent rise in your baseline pressure. If you wake up feeling unrefreshed despite getting 8 hours of sleep, or if you have been told that you snore or gasp in your sleep, your high blood pressure is likely a secondary symptom of a respiratory issue that no amount of cardio can fix. We must also talk about the critical role of magnesium, which is often called the relaxation mineral. Even in a healthy diet, it is surprisingly easy to be magnesium deficient because modern soil depletion has reduced the mineral content of our vegetables. Magnesium is essential for the function of the pumps that move sodium and potassium in and out of your cells, and it helps the smooth muscle cells in your artery walls to relax. Without enough magnesium, your arteries remain in a state of semi-contraction, making them stiffer and more resistant to blood flow. Many people who focus on high-protein diets or intense training regimes lose magnesium through sweat and metabolic stress, further exacerbating this hidden cause of hypertension. Furthermore, we cannot ignore the impact of even moderate alcohol consumption. While many healthy lifestyles allow for a glass of wine or a social drink, alcohol is a potent vasoconstrictor and a stimulant to the sympathetic nervous system. For some individuals, their body is hypersensitive to the toxins in alcohol, causing a sustained increase in heart rate and blood pressure that persists for 24 to 48 hours after consumption. If you are a healthy individual struggling with high numbers, try a total elimination of alcohol for 30 days, and you might find that your numbers normalize without any medical intervention. We also need to discuss the psychological component of the high-achieving healthy individual. Many people who are dedicated to fitness and health also possess type A personalities, meaning they are constantly in a state of mental drive and perfectionism. This constant mental engagement keeps the nervous system in a state of high alert, which the body interprets as a physical threat, leading to a sustained elevation in blood pressure. At Dr. Queen Senior Healthcare, we advocate for the integration of deep breathing exercises or meditation, not just for mental peace, but as a direct physiological intervention to lower blood pressure by stimulating the vagus nerve. Now let us look at the diagnostic roadmap for someone in your position. If your lifestyle is perfect, but your numbers are high, we recommend a 24-hour ambulatory blood pressure monitor. This device tracks your pressure throughout the entire day and night, providing a far more accurate picture than a single reading in a doctor's office. It can reveal if you are a non-dipper, meaning your blood pressure fails to drop at night, which is a high-risk indicator for heart disease. We also suggest testing for your plasma aldosterone to renin ratio to see if your adrenal glands are the silent culprits. Your health journey is unique, and when the standard rules of diet and exercise fail, it is an invitation to look deeper into the chemical and structural nuances of your body. Do not feel discouraged if your numbers are high despite your efforts, because identifying these hidden triggers is the key to preventing long-term damage. At Senior Healthcare, our mission is to empower you with the truth so you can make informed decisions that protect your heart and your future. Remember that high blood pressure is a manageable condition, and by addressing the root cause, whether it is mineral balance, sleep quality, or genetic signaling, you can maintain your health for decades to come. Thank you for staying with us through this explanation and for taking your cardiovascular health seriously, because staying informed is your most powerful tool in the pursuit of a long and vibrant life. This concludes our special report on the hidden truths of hypertension, and we look forward to helping you navigate your path to optimal wellness.